need to pursue a specific major as an undergraduate, but they should complete pre-medical courses including physics, biology, chemistry, English, and math. However, you must go to medical school to obtain a doctoral. A license required to practice medicine and a certification in family medicine may also be required. A residency of 3 to 4 years is also required. For one to become a family physician, one must have extensive medical knowledge, compassion, attention to detail, critical thinking, good verbal and written communication skills, and knowledge of medical software.
One would need to take anatomy courses, patient care courses, pathology courses, and family medicine courses. In the anatomy course, medical students intensely study human anatomy, and they will probably take many anatomy classes throughout their studies. In the patient care course, doctors learn communication skills and patient examination. In pathology courses, pathology classes teach medical students about diseases from cellular level. Some doctor programs require all medical students to take a family medicine class, while other programs reserve these classes for those who intend to practice family medicine. Those specializing in family medicine will take multiple classes in this topic.
The field experience that is required to become a family physician is a residency program. Residency programs offer aspiring doctors the opportunity to work directly with patients in a specialty area of medicine. Some specialty areas include internal medicine, pediatrics, emergency medicine, psychiatry, and anesthesiology. Residents may be responsible for a number of patient care activities, including developing problem lists, performing physical exams, and compiling medical histories. Depending on the specialty area, a residency can last from anywhere between 3 and 8 years. Most residents usually complete their program in hospitals.
The program will take 3 to 4 years to complete. A family physician requires 3 years of being in a residency program.
Some of the best universities for this particular field are the University of Toronto, McGill University, University of British Columbia, and University of Alberta.
A physician evaluates symptoms, runs tests to diagnose a patient's conditions, and then prescribes medication or treatment to take care of the illness or injury. A physician also counsels patients on how to prevent illnesses. Physicians need to be good communicators, committed to their work, and have desire for lifelong learning.
Physicians can choose to practice in a variety of settings, including solo or group practices, family health teams, hospitals, community care centers, public health units, academic research centers, labs, private industry, and government. Increasingly, physicians work collaboratively with other types of healthcare providers and interprofessional teams to deliver quality care.
Earning for family physicians depends on a number of factors, including experience, geographic location, and whether they are self-employed or employed by a hospital. Income for family physicians range from less than $100,000 to $250,000 a year. Family physicians begin their careers as residents, where they usually earn $44,000 to $65,000 a year. Working conditions for family physicians include a wide range of patients and illnesses, working in community-level offices and clinics. The responsibilities that a family physician has are taking patient histories, performing or requesting diagnostic tests, making diagnoses, prescribing treatments, administering vaccinations, and performing follow-up examinations. As well, educating patients in disease prevention and health maintenance, preparing medical records, clinical reports, and correspondence.
A family physician should get to their office at 7:45 a.m., just enough time to get ready for an 8 o'clock appointment. Between 8 and 9:30, a doctor may see 10 patients. Most of these appointments are done quickly. A physician can expect different types of appointments, such as checkups, vaccinations, and appointments for people who are ill. At 10, one may have a daily clinical meeting where one gets together with the other doctors and they discuss cases of particular concern. Between the end of this meeting and lunch, a doctor may see another 8 patients. After lunch, a physician may see another 17 patients in the afternoon and into the evening.
The most appealing part of this job would have to be helping people, because that has always been a dream of ours. The least appealing would have to be the amount of time it takes to become a family physician, because we would love to go out into the workforce as early as possible.
The possibilities for promotion is to become a head doctor for a certain ward at a hospital. For example, a family physician can become the head doctor in the pediatric ward. Also, another promotion can be to increase your role in a private office. For example, instead of doing the blood tests and vaccinations, a family physician may hire someone to do that for them. Therefore, the family physician may run their office like a business and they will have multiple employees.
Doctors have incredible job security. All types of physicians are in high demand due to the aging population. You can work as a doctor for your entire professional career. It is a very demanding career that requires a lot of commitment. The hours you work can compromise your social and family life. For this reason, there are relatively few people who are willing to make such sacrifices.
The future does look very promising since there is room for a promotion and the yearly earnings are extremely favorable. A physician can support themselves and their family on the salary of a doctor since it is extremely high.
This field is growing due to our aging population. There will be a major surplus of physicians in this field due to our aging population and the amount of new illnesses that are being discovered.
In Quebec, this field is a combination of both. A family physician can work in the public medical sector in hospitals and public offices, and these services are free due to our Medicare system. The public sector and hospitals are controlled by the government. However, there is a private sector in the medical field. The patients of a private family physician have to pay for these services since they are in the private sector and is not controlled by the government.
There is a lot of new technology that is being discovered in the medical field. For example, the MRI machine, the radiology centers for chemotherapy, and many others. Many people in the medical field are also finding different viruses and illnesses, and they are trying to cure them. These cures to different illnesses are also being found due to these technological advancements.